We all know when we're raising our children with special needs that we often have to do personal cares for our children a lot longer than we might normally. And I'm very, very pleased today to have with us on Awhi at Home, Sene Ioane, who is a dentist specialising in patients with special needs and complex medical needs. Sene, welcome to Awhi at Home. Thank you so much for joining us. And I'd like to start, please, by just asking you about why it's so important for ordinary whole body health to have good dental health.
The thing with the mouth is, for some strange reason, it's often considered as quite separate from the body and overall health, but obviously it's one of the main entrance points to the body, and it is so important that it maintains, we keep it in good health, because the mouth is one of the easiest ways for bacteria to travel around your body. It can, the teeth are connected to your bloodstream. Bacteria from your mouth, if there's any infections or sometimes decay, can creep under the gums and into the bloodstream and actually travel around and cause quite serious health conditions. Your heart, your lungs, it's often linked to cardiovascular disease. There's all natural bacteria is often in your mouth anyway, but it's trying to maintain a balance of, just like your gut, good bacteria and bad bacteria.
Okay, I've got a child whose hands are constantly in her mouth and really gobby. Is that likely to be helping her immune system, or is it just something I should really, really try and stop from happening?
I mean, look, we have food that isn't perfectly sterile. There is nothing that's pretty much sterile unless it's been in a sterilizer and opened and then put in the mouth. So hands, etc., they often will go into the mouth, and that's pretty normal to build up your immune system over time, I would say. But in terms of when it comes to maintaining good oral health and the teeth being connected to overall health, so it's often based around decay, unfortunately. So if you have any decay, it will cause a cavity. The decay and the cavity will eventually get deeper into the middle of the tooth, which is where the nerve and the blood supply live, which keep it healthy and alive. So our concern there is that we need to keep bacteria out of that area. And when you say we have a deep filling, it means it's close to that, or a deep cavity, it's close to that. And it's that nerve and blood supply that is connected to the blood supply through the whole body.
What can we do to try and normalize or get our children used to or accepting proper teeth cleaning?
The main thing is getting it part of the routine, to be honest. Making sure that it's something that fits into the start of the day and the end of the day, so that it's something that's not missed. It's just something that your children will expect and almost hopefully eventually go, hang on, will think, or grab the toothbrush going, well, what about this? It is hard. And a lot of parents often come in and say, oh, look, I've been trying to do this, but I don't get it. It's really hard. They gag. I can't get here. But I look and I'm like, you are doing an amazing job. Majority of the time, all of you do an amazing job. Just at the end of the day, you do the best you can.
I'm very lucky because you're Claudia's dentist. How do you approach going into a mouth that you don't know or that might bite you?
Yep. So, to be honest, I
don't think she's bitten you, just to put that out.
No, no, she isn't. For me, I kind of just go very slowly at the start. I talk to the carers, the parents. Most importantly, always acknowledge, obviously, your children, the patient, because it's their appointment and it's about them. But just not trying to get my job done there and then. If I get an appointment where I don't even get in the mouth, that's fine. We've had a chat. They're comfortable with me. Maybe I'll bring them back in 3 months' time or less if I think that the familiarization will help. It's not necessarily all about the teeth, but even desensitizing to the environment or to letting someone in your mouth. Getting in there with a dental instrument that vibrates is all about just introducing new things and getting them used to it. If we eventually might need to do something, It's
So should
worth
we be
trying.
getting, when you talk about instruments that vibrate, should we be getting electric toothbrushes? Is that a good
Well,
investment for us?
that's an interesting one. Sometimes people will do better with an electric brush, but there's so many sensory issues and a lot of patients, obviously, with special needs. So it can be a bit of a hit and miss. The main thing with an electric brush is it's awesome, and a lot of the time it can be more thorough, but it's also a very small head. And that means if you don't have a lot of time to get in there, you don't often get around as much with a tiny head. The thing is that a lot of people that are brushing themselves, as in if your children are brushing their own teeth, I think an electric brush can often be quite helpful because it kind of does a lot of the work. They don't necessarily have to do all the motions. You can kind of just hold it there, gently move it across, and it's doing a lot of the work there. A lot of patients actually like the sensation. They like that gentle massaging of the gums or the increase in stimuli. So look, I think trial and error.
There's been a bit of talk lately about apps, that you can get, that you put on your phone that can encourage, I guess, making a bit of a game out of toothbrushing. Is there any harm in that?
Anything that will assist or help in doing a better job is beneficial. To be honest, I don't think there's anything out there that I'm aware of that is going to promote the wrong thing to some degree. So absolutely, apps that can help in terms of the time that your child might be brushing, apps that might help with the technique in terms of making sure you get every aspect of the mouth is really helpful. But look, any little bit helps at the end of the day to have a thorough job.
Thank you so much for all of your time. You're amazing. I've seen you in action.
Oh, thank you so much for having me. Happy to answer any questions, actually, if anyone wants to write any on the Facebook page, and you can flick them on to me, Fiona.
Cool, I will. I'm happy to do that. I'm really grateful for your time, and it's your time is very precious. It's taken us a wee while to get this interview done, but we did it.
Thank you.